Hi guys, welcome. Sorry I'm getting started a little later today. Welcome to What is a Pelvic Floor PT? So I am super excited about this one. We're going to give it a minute to let a couple people join and let Dr. Allison and Body Motion PT join us as well. So I'm just going to give it a minute, kind of let people join. Instagram is telling me they're letting everyone know that we're live. So we're just going to kind of join together. Hope you guys are having an awesome day. I'm really excited about this live. Instagram, hang on, we're telling more followers to join your video. So I'm really excited to have Dr. Allison on. There she is. Super excited about this one. I am going to wave and let her in. Here we go. Awesome. Waiting for it to connect. Really excited to have Dr. Allison here and have this as a resource.
Hello.
Hey, can you hear me okay?
I can hear you okay.
Awesome. I'm really excited. Thanks so much for joining.
Thank you for having me. I'm excited to be here.
Yeah, I'm really excited to have this as a resource, whether or not people can join live or catch us later on IGTV, YouTube, or all the things. I think this is going to be such an amazing resource, so I'm so glad we're connecting. How are you doing today?
I'm good. I'm trying to find a good place that I can prop this phone because I don't have my the little tripod thing today.
Oh yeah, I have my tripod set up. I feel so high tech.
You are so high tech. I got to get on your phone. Okay.
Perfect. Yeah, no, I'm really excited just to talk all things pelvic floor PT because I get asked so often. I've had a few conversations. I've been doing some free consults this month just to connect with women and have every single consult I've referred out to a pelvic floor PT with things that have just come up in conversation. And, you know, of every woman I've spoken to, all of them, I didn't know, I didn't realize that I should do that or I could do that. So I'm just super excited to chat with you all things pelvic floor PT, and we'll just kind of get into it. First off, why don't you just introduce yourself and tell us where you're located and where people can find you?
Yeah, I'm Dr. Allison Fells. I am the owner of Body Motion Physical Therapy. So we help moms through conception, pregnancy, preparing for vaginal deliveries, and recovery postpartum. And really, you know, postpartum is forever. So recovery at any stage in the game afterwards. So we're all about pelvic floor health and really that just being such a driver and root cause of so much in life, and that we'll dive into. But that's really what we focus on here, and that's what we specialize in. So
awesome. Yeah. And also just wanted to mention that you do work with clients virtually too. So you don't necessarily have to be in Seattle to be able to work with you.
Absolutely. Absolutely. And we work with people on an out-of-state basis just by coaching. So yeah.
Awesome. Well, I thought we could just get into it. I had like a few questions obviously prepared, but I figured we just go with the flow of the conversation. And like the first one that comes up all the time is, what is pelvic floor PT? Like, how is that different from just going to another physical therapist that I go to for my shoulder or my knee or whatever ailment is happening at that period of time? Like, what is it that you do that's different?
Totally. So we're going to look at, so if you go to, you know, PT for your shoulder, we'll use shoulder as an example. They'll look at your shoulder, and not necessarily, and that's standard. That's good. Your shoulder might get better. But if, let's say that you're, I don't know, 35 and you had a C-section 5 years ago, and somehow your C-section scar is playing into that shoulder pain just based on, you know, based on how it's pulling, the scar tissue is pulling, or based on how your core is firing and activating and how you're using your core altogether, that could just make this shoulder pain come back and be persistent if we didn't get to the root cause of it, which possibly could be a C-section scar. So what a pelvic expert physical therapist is going to do is they're going to map out your whole history. We're going to talk about like your athletic history. We're going to talk about kind of everything that goes through the pelvic floor. So your bowel function. So what's that relationship been with like pooping your whole life? You know, has it always been hard for you to poop? Do you find yourself bloated, or, you know, things like that? We're going to go through your sexual history and also what it looks like urination wise. And are you able to hold your pee? And so we kind of get a grasp of how your pelvic floor is functioning by asking these questions, and then kind of mapping out what other ailments in your body or discomforts, or where do you feel like you've been tight your whole life, or different parts of that, and then kind of creating this tree of how they're all connected through the pelvis.
Yeah, it's so neat. And one of the things I've learned just from you and just through different education is really understanding that core canister in the function of our inner core system, and learning how powerful the pelvis and our pelvic floor and our diaphragm and all the muscles that kind of make up that central stability system really play a role in things that may pop up like 20, 30 years from now. And, you know, my mom will say, oh, I have this ailment, and like, well, she had C-section, you know, I'm gonna age myself 30 plus years ago. And it's like, well, you know, have you thought about this or this? And it's like, oh, like I didn't even think this was connected. And so that's what's always amazed me about pelvic floor PT, is just connecting those dots and really getting to the root of the potential problem.
Yeah, yeah, absolutely.
And kind of along those lines, like I know a lot of women we've talked about before, like don't know pelvic floor PT exists, or it hasn't come up before. You know, they get the clearance at their 6-week checkup, or maybe even before potentially. You know, if they get that clearance, should they be talking to their OB about pelvic floor PT? Like, do they still need to see a pelvic floor PT even if they're not having any pain or discomfort?
Yeah, Erica, that's such a great question. And I think that's such an important question. And yes, I wish that like the checkup at 6 to 8 weeks would be with a physical therapist. You could, you know, check in with your OB virtually, or check in, and that's what we do now, right? Check in with, you know, you stop bleeding, the locatia has stopped, you know, everything has stopped coming out of your body. And that's like the only barometer for returning to exercise, returning to intercourse. And so, you know, occasionally you'll have an OB or a midwife check for diastasis and maybe prolapse, but you don't have, they're not putting you in different positions to check for the muscle function and coordination, and, you know, seeing where your organs are when you're in different places in space. And so to me, I'm so biased. So you're just going to have a biased perspective this whole time.
Yeah.
But you need to have a pelvic floor assessment after babies. And really what we find, and it's not just the pelvic floor assessment, it's an abdominal wall assessment. It's what's the alignment look like? What's the balance of your body look like? So we're looking at all these things. And yeah, maybe you're safe to hit the gym, but if we know that your bladder is a little bit lower right after you have a baby, let's give you some stuff that can help make sure that bladder can like sink back into place and is not going to leave you with a prolapse the rest of your life, you know, if you were just cleared to go back to your HIIT workouts. So I think I am so biased. Absolutely everybody needs a pelvic floor pelvic expert physical therapist assessment after childbirth, and that would be ideal. I also think it's incredibly important just to not neglect the healing, you know. So you get your 6-week go ahead, and that's great. And maybe you even get cleared by the PT to do some things that you want to do. But the reality is, like, your tissue has just expanded and contracted, and you've had a baby. And there is, even if you haven't torn, there's micro tears that create scar tissue that need hands-on assistance. And so going through a course of treatment can be just absolutely essential in preventing alignment issues or nagging aches and pains down the road. So, you know, even if you get that clearance right away, I think doing the work initially is so great, you know, to whatever capacity that looks like. And that's going to look so different for every single mom and every single situation. But just even having the awareness is important too.
Yeah, I think that's super important. And I think that I learned that just firsthand for myself, because the first time I saw pelvic floor PT was after I had my son, and I self-referred just because I had read about it and knew that it was super important. And otherwise, I don't know that I would have stopped. doing what I was doing. I remember running on a treadmill like 6 weeks postpartum. I felt like I had this badge of honor because I had been cleared and like I was physically able to do it. And I remember running on the treadmill and literally feeling like my insides were like, I felt so heavy. Like I felt my insides were going to fall out. And I just kind of stopped. It's like, okay, this isn't right. Like this isn't, what I should be doing. So like thinking about pelvic floor PT, obviously we've talked a lot about like postpartum. Like I had that heaviness, that feeling that kind of gave me the, okay, I should really go seek help. But
Yeah.
Is there an added benefit to seeing like a pelvic floor PT, let's say when you're trying to conceive or during pregnancy or even, 20 years down the line? Like some women will say, oh, it's too late. I'm like, oh no, it's never too late. But like, what are kind of the stages in which someone can see you and like, what can you help them with at those different stages?
Yeah, absolutely. So to me, it's amazing to start preconception. We work with people that have been on long fertility journeys. Maybe they're trying to, they're at their wits' end and they're trying IVF, and maybe IVF isn't even working. We work with people throughout the spectrum of conception and whatever their fertility journey looks like. It is so, and pelvic PT can be a huge missing link in someone's fertility journey. So dealing with adhesions throughout the pelvic floor, the abdominal wall, these can be blockages that are literally mechanical barriers to conceiving. And so it's amazing to help someone, preconception, because it can just be such a good piece of the puzzle in really helping that fertility journey and assisting it. As far as people who come pre-conception, they're able to gain that control of their pelvic floor that we like to see during pregnancy. So if someone comes preconception, they kind of already have that coordination that we're trying to train. And so it makes it for just a little less training during pregnancy. The muscles have already responded to the work that we're going to do. And that's amazing and great. So that sets us up for having less training, or maybe not having as much hands-on work needed to prepare for childbirth. So I think a big piece of the puzzle too that we do during pregnancy is help women prepare their pelvic floors for birth. Really not just teaching them how to push, that's part of the game, that's part of the coordination training, but really seeing like, okay, where's your restriction? What are these muscles doing? And how can we help open them up so you're ready for childbirth? You work with, I'm sure, like a whole wide range of people, but especially your women who have been like athletes forever. And sometimes those are the ones that have trouble conceiving as well, just because of the high fitness and all that stuff. Have that really tight hips, right? Or a really tight pelvic floor, and they're strong, and that's amazing and good, but it has to be dynamic. And a lot of times what we find is we have to open up that third layer of the pelvic floor. There's 3 layers. And so doing that kind of work can have a huge impact on not just helping someone stay comfortable through their pregnancy, but really preparing for a vaginal delivery.
Yeah, and I can speak just to that end as like an athlete my whole life. And that is something I notice in my own pelvic floor all the time, and just through my hips, and my adductors are insanely tight. So just constantly trying to release my adductors. Because I know that the adductors are also a gateway to the pelvis, and anything that's a gateway to the pelvis is also a gateway to the pelvic floor. So it's just been a long journey for me, and understanding and looking at my first delivery and pushing for 4 hours because I had absolutely no idea how to breathe and how to relax my pelvic floor, and thinking that my pelvic floor was something that sort of just pushed the baby out, which I now know it's not the case. So just speaking from experience, that is something that pelvic floor PT is so beneficial for during pregnancy, is really understanding how to fully relax the pelvic floor. And something that I've noticed in working with women is, they obviously, I can't get that internal feedback that you can, but they think, and I think, my pelvic floor is relaxed, but actually it's on a level, ground floor, level 0, top floor, penthouse, level 5. We think it's relaxed, but it's actually at a level 2, like all the time.
Right.
So understanding how to get to level 0 really takes the help of a pelvic floor PT and someone who really knows what they're looking for. And unfortunately, I love working with pregnant women, but I can't get that type of hands-on feedback that you can.
Yeah, yeah. And it's nice to have balance too, you know. I mean, the stuff you're doing supports the skeleton, you know, you're working the glutes, you're working the core, which is going to take a load off the pelvic floor, so the pelvic floor doesn't have to be so tight and gripping, and the adductors don't have to be so tight. But I think, yes, of course, you know, it's just it's so necessary, and I don't know why no one talks about it. Like, this is your this is where the baby's coming out, and I really wished for my birth, for both of them. It's like, I have a tight pelvic floor and I know how to coordinate my pelvic floor, but unless someone's like working on these muscles for me, it is so hard to like get myself there, you know, because I run high. I'm like a type A personality, you know. I have stress, and like it's hard to let yourself go and let yourself relax unless you have that guidance. And so much of it is not just like learning that, but you know, changing the texture of the muscle. I think I've told you before, Erica, that sometimes when you feel a muscle that is really like tight and dehydrated, it's kind of like beef jerky.
Yeah, your beef jerky analogy.
Yeah. And we want to change that to like a steak. So it's nice and soft and squishy and hydrated, good blood flow, and that will improve the coordination. And so, you know, a lot of that can be done with a pelvic expert physical therapist. And, you know, teaching you to do it yourself too is definitely a possibility, if you know what you're doing, you know, as long as you're cued through it and all that good stuff.
Awesome. I did
Yeah.
have kind of leading into that, and we'll come
Yeah.
back to like the tail end of what we were talking about is, you know, if I make an appointment to see you, like what can I expect at my first appointment? Regardless of where I am in my journey, like what should I expect coming in to see you?
Yeah. So we typically we always start our journey together, or our relationship together, with a virtual consult that's complimentary. For us, that's important just so we can screen out make sure that everything's okay and healthy to start assessing, and to really start talking about and make sure that you don't need any other referrals elsewhere. And so we get your story kind of during that time and can really decide at that point where things need to go. So after that initial consult, then we do, typically it could be an in-person or it could be a virtual actual evaluation. If it is in person, it does allow us to assess the actual pelvic floor function. And so what this looks like is we would have someone come into the office. We're doing a full posture assessment. We're looking at alignment. We're, you know, exploring everything that they mapped out, that we've put our, you know, created the guide for. And we're just going through the tissue and kind of manually touching the body and seeing what things are doing, seeing the texture of the muscles, seeing the strength, the flexibility of them. And then we will look at the abdominal wall. It depends like at what point in pregnancy, you know, things are a little different, whether you're postpartum or pregnant or preconception.
Yeah.
And then we will recommend for, you know, depending, as long as you're not on pelvic rest or you're not in your first trimester, we'll recommend an intravaginal pelvic floor assessment. So this is inside the vagina, looking at the different layers of the muscles, looking at the organ placement, kind of where things are shifting and how we can help you and kind of prevent injury as well. Like make sure that your training is assistive for everything that you're doing and like where your body is actually at. Yeah, is that helpful?
Yeah, that's definitely super helpful. One thing that does come up, and I talk to women a lot about,
Yeah.
how does like an intravaginal assessment from you look different than their OB? Because I always say, no, there's no stirrups or any of that. Like, what does that look like from
Yeah.
you to the OB?
Yeah, so you're in a comfortable position, whatever is safe for your body at whatever point in pregnancy you are, or postpartum, and your your legs are supported with pillows, and it's soft, and you're draped, and we're looking at the muscles. So your OB doesn't evaluate the muscles and ligaments inside your pelvis. They're mainly concerned with like organs, like where the uterus is and, cervix. During pregnancy, a physical therapist will not go by your cervix or touch your cervix because that's contraindicated during pregnancy. Yeah. So, but we will look at all the muscles surround, inside the pelvic floor. And that's something that that an OB won't do. And quite frankly, they're not skilled to. There was a movement like a year ago that the ACOG guidelines shifted. So American Gynecological Association, they shifted their guidelines to try and facilitate all of the OB curriculum, including pelvic floor assessment. But we're just not there yet. No one's like learned it. And I don't know where it's at as far as like it's actually taking off. But that would be great. The more people that can assess, the better, because then it will get people to the right places.
Yeah, no, I definitely agree. I know that ACOG updates their recommendations quite often. So we'll have to see. Just from what I've read in the literature and just seeing things change, I do know there's a lot more conversation around pelvic floor PT, which is great.
Yeah.
From what you've seen in clinic, like what are the most common things people typically come to you for? Because I know a lot of times people come to you once there is an issue. So if there is an issue, what are the more common things that people are coming to you for?
Yeah, I would say someone who's coming to us for an issue, whether that's low back pain during pregnancy or SI pain or hip pain postpartum, or even leaking urine. Those are the lucky ones because those are the symptoms that are drawing you, to a pelvic expert physical therapist. But what we see is like, it allows us to teach and train you for your body. So like if you had SI pain and you reached out for that during your pregnancy, what it allows us to do is like, let's make sure that your pelvic floor isn't causing this SI pain, which a lot of times can refer pain, your pelvic floor can refer pain to the SI joint.
Oh, wow.
And so that's like the back for all the people watching. It's like the back, your low back. So if you could like touch your finger to where your is in your low back, a lot of people will touch it to that like SI area. And so pelvic floor can refer pain there. So the people that like seek treatment for that during pregnancy are actually the lucky ones, because a lot of times then we get to say, okay, let's release these muscles around the pelvis so we can really make sure that your pelvis is able to open for birth. Let's make sure, is your pelvic floor referring the pain to your SI joint? Let's make sure we check all that. And is your pelvic floor, is it healthy? Are the muscles healthy and ready for a vaginal birth? Are they, of course, that, just doing that alone is going to help the SI pain and, take it away and make it so it's a pain-free pregnancy. But it's like, okay, now we get the double whammy of like saying, yay, your pelvic floor is now prepped for your vaginal birth, and, you're going to decrease your likelihood of tearing. And here's all the things you can do to not just keep the SI pain gone, but really help prepare for the birth. So yeah, that's like a prenatal one. I would say postpartum, of course we'll have some people that come postpartum that are leaking urine. And again, they're the lucky ones because a lot of women aren't leaking until 7 months or 7 years postpartum. And so it's like, if we can kind of get there sooner, the better we can make things more balanced, the better we can like get to the root causes initially so things don't get worse. So
yeah, no, that makes sense to me 100%. I just thought I'd kind of bring up just a couple things that have come up in conversation and get a sense of what your feedback would be. So a couple reasons I've referred out to pelvic floor PT recently. I spoke to someone yesterday who has like pain with intercourse. That's pretty much her only complaint is painful intercourse. And, she had a C-section. So, pain with intercourse, like, I don't know if that's something that comes up a lot. And then just, as you mentioned, kind of leaking, like different types of leaking. I know like there are several different types of incontinence, one of which is urge, which is just that like sudden, like, oh my God, I need to get to a bathroom at this exact moment in time, which is not necessarily something a lot of women like think would be like something they could see you for, which is pretty unreal. And I do talk a lot about poop. I know with pelvic floor PT, we talk a lot about pooping strategies too.
Yes. I'm so
Um,
proud of you. And it's so good you're asking these questions because not a lot of people are. You know, and even if you ask the question, it's great because some people and many people we work with, they don't realize that they're actually having discomfort with intercourse until they come in again and they're like, oh, wow, it's either so much better or I never really paid attention. I kind of just like grit my teeth through it and like, you know, braced for it. And so it's so nice that you open the door with that conversation.
yeah, it's, you know, I spoke this, and I'm just saying these because these are things that come up, you know, with a
Yeah.
mom who is like 7 months postpartum and still has major issues with hemorrhoids. And she, just based on other symptoms that we discussed, like I had a sense that, you know, she probably has like a tight pelvic floor. You know, I don't know that 100%, but just that's some of the things that came up. And I talked to her about how, you know, those hemorrhoids and the painful poops could be, you know, she could be guarding, like just holding on to tension because she's afraid to go to the bathroom. And it was never brought up to her to see like a colon and rectal doctor to like potentially get the hemorrhoids taken care of. She's just been dealing with uncomfortable bowel movements for 7 months. And so these are conversations like I have, and I know that you have, that I wish were brought up more. I know it's kind of a weird thing to talk about. I'll always preface and say, like, I know that these questions are personal, but I promise they're purposeful. Like, there's a reason I'm asking them. I'm not just asking you about your pooping to like talk about poop. Although once you're a mom, like you talk about poop all the time. So let's just be real.
Yeah. It's so normal that, you know, when you start talking about it, it just gets easier. And it's so great that you're asking these questions. And
Yeah, I did, before just looking at time, I wanted to
yeah,
have you touch on just a couple things, because I know that diastasis and pelvic organ prolapse are two things that come up a lot, just in Google searches, and with postpartum. And I know there's a lot of fear around diastasis. And I thought maybe you could just talk a little bit about kind of what it is and how you would support someone, and kind of what we look for, you know, in terms of depth, tension, that type of stuff. And I thought
yeah.
maybe just a little thing, a little tidbit.
Yeah. So diastasis is the separation of the linea alba. So the linea alba are these, your two six-pack ab muscles are connected through the linea alba. And so during pregnancy, you'll get some stretch and separation there. And really all the current research is now showing everyone's getting that stretch and separation. And so there is some degree there, but you want to minimize it and you want to keep it strong, and you want to be able to generate really good tension even at your 10-month pregnancy, you know, right at delivery. And um and so uh the way to do that is really by learning how to manage your pressure, which is a lot of breath, and by activating certain muscles in certain orders that can really help maintain that tension, so you're not going to rupture anything, create a hernia, or create a clinically significant diastasis. So that would be like that separation in your abs after your baby. So what we look at starting, you know, right away postpartum, you can really assess the diastasis at any point in the game, is we're looking at the finger width at which there is at the middle of the belly. I'm going to try to angle my body. Maybe I'm just giving it a cleavage shot here. Yeah. So here's belly button. Okay. So we do this laying on our back, but we stick fingers into belly button and then crunch up. So this is a way to self-test. We have this somewhere on our website or somewhere on, you know, social. You can find so many ways to check your diastasis, but you do it the whole length up and down your abdominal wall from your xiphoid process to your pubic bone. And we're just looking at how much separation there is in that area. Hopefully there's not any, and then hopefully it has really good tension. Now, if you are able to like sink your fingers in and you feel both sides of your abs and you're like, what is this hole in my belly? Or why does it still look like I'm 6 months pregnant? Even though, you know, I just had the baby's not even in there anymore. So all of this stuff, are what people will say when they have a diastasis, a clinically significant diastasis. And so when we're looking at how to heal a diastasis, there's a million in a trillion fitness programs, right, Erica, that
Yeah.
heal diastasis, okay? But really, and close the gap. That's the fancy word. But we're not looking to close the gap. Really what the research has showed us is that we're just looking to generate really good tension. And when you generate tension in the linea alba, you actually won't feel as much of a palpable gap. So sure, if you want to call it close the gap or not, but we're just looking to really have good tension in the abdominal wall. Things that get neglected when you're just doing a fitness training program for closing the gap or treating your diastasis or correcting your diastasis is the pelvic floor. So if we had a balloon and we were talking about a balloon and the front of it was that abdominal separation, and if we squeeze the bottom of the balloon, that would make a lot of pressure on the front of the separation. And squeezing the bottom of the balloon is like having a really tight pelvic floor, which you'll find after a vaginal delivery or a C-section. And so those have a huge impact. So treating like holistically, treating the diastasis and helping the diastasis heal, it's important to look at the pelvic floor. And the reason I'm bringing this up is because a lot of, like, even if you go to PT just for your diastasis, any like general PT can help you with that. But the missing link, and I think this is where it comes in important for wherever you are in the world, would be to just know what your pelvic floor is doing, the healing of the diastasis. Does that help? Is that where you wanted me to go?
Yeah, that was great. Sorry, my screen went black. My mother was trying to call. So sorry about that.
So
I couldn't go on airplane mode or else I don't have Wi-Fi. No, that was super helpful. And one thing that I did want to mention is, with diastasis, as Dr. Allison mentioned, there is a lot of concern around closing the gap. And one thing that I'll actually pose, like a question I'll pose to women is, well, did you know if what your status was even before you got pregnant? Because there are men, there are teenage girls, there are people who have never had children that have some form of gap. So you can also have a really strong, the tissue can be really strong, but you might still have a 2-finger diastasis. And by recent research, you're very strong. You can generate that tension. Your pelvic floor has that juicy steak ability. It's nice that you can relax tension, generate tension. So I always like to just say, it's not necessarily about closing the gap, because the gap may never close, but how is the system functioning optimally to support the activities that you want to do? And that's really the goal. So I don't, in programs, I don't really program sit-ups or anything like that per se until way far down the line. And that's usually just because people want to do sit-ups. We need to be able to do flexion, but there's just so many ways we can train our core and function that don't involve just going like this all day. So no, I just wanted to touch on that because I know it's such a big fear, and I get a lot of questions on that. And then the last question, and then I'll just kind of have you do a little blurb, is with prolapse. I know that that's something that could potentially pop up postpartum or even years postpartum. What is prolapse, just so people have a heads up on that?
So pelvic organ prolapse is that one of the pelvic organs has descended into the vaginal canal. You can also have a rectal prolapse, so that's where your rectum is coming out of your rectum. And that's not as common, especially postpartum. It still can happen. But what is common is your uterus could descend, so it feels like your cervix is lower. Your bladder could descend and kind of creep into the vaginal canal, or your rectum can creep into the vaginal canal. It doesn't mean there's a hole. It doesn't mean that anything is going to come through and be dangerous. It just means that these organs can descend a little bit. And clinically, so the numbers, the last time I saw, and it's in my book that's coming out, it's 40 to 60% of postpartum women have some degree of prolapse. However, clinically, we see nearly 100% of women postpartum have some degree of descent of the pelvic organs. And so it's just important to just keep that into mind when this becomes an issue. And really, I think maybe I'm going too deep, Erica, and just stop me if I am.
Oh no, this is great. Keep going.
Okay. So if there is descent of the bladder, your body, and so you just push a baby out and things are going to feel heavy and weird and you know, initially people are like, what is falling out? There is pressure, like what's happening? I'm scared to poop, right? So the body's initial reaction is to like tighten and squeeze and hold it all in. And I think what we see clinically is most of our moms within like the first 5 years postpartum, they get stuck in that squeezing and holding everything in, and they never go past that. And then they're doing more and more and more and more and more Kegels just to keep it all in. But we forget that like the pelvic floor has to actually open. And so clinically, I kind of explain it that when things are that tight, it's almost like impossible for these organs to kind of like sift back into its normal places. And so we have to teach the pelvic floor to open and relax. And that can be really scary, especially if someone clinically has a diagnosis of like a cystocele, which would be your bladder coming in, or a rectocele, which is your rectum coming in. And so it's even more reason to like work on relaxing and opening the pelvic floor, just so things can sift back into place, and then you can strengthen everything back up in it. But as long as you're strengthening and then letting it go, and strengthening it and letting it go, and after they do a workout with you, like doing your breathing just to help open things back up is just so underrated, and so important.
Yeah, no, breath work is always a part of kind of everything we do, especially early postpartum. Um, I did also want to just mention with prolapse that sometimes, you might not be so symptomatic. Like I know that you've mentioned before, some women come in because they have like back pain, lower back pain or hip pain or something like that. And then they come to realize that they do have some like degree of prolapse, which there are various degrees of.
Right.
So it's something I'll say just real quick. I had, when I was 9-10 months postpartum, I had hernia surgery, inguinal hernia, which is like basically in your groin. And I thought I had prolapse because I kept feeling like a bulge sensation. But needless to say, that was a hernia. So it's a little different. But it's so helpful to have someone like you as a resource just to ask these questions. And I always like to recommend, seeing someone early postpartum, but then like continuing care and going back like every few months just to get a pulse check on how your body's doing. So how can someone get in touch with you or find you so that they can maybe make this appointment or just even pop into your inbox to ask some questions?
Yeah. Feel free to pop in the inbox and ask some questions. And then in our link tree, you'll see a request for a free discovery visit. And you can just have a conversation with us, and you can be anywhere in the world and we'll have a conversation with you, and at least can put you in the right direction or right place. It's our passion, and this is why we do it, so everyone can get the care that they need and really get started in the right direction. So thank you so much.
Awesome. Thank you so much for joining us. If you look in the comment section, Devin or Dr. Allison dropped in the link, and I'll make sure that we include Dr. Allison's information on this post. She's amazing and also hosts free seminars virtually, just covering all different areas of motherhood and recovery and preconception and beyond. So definitely check her out. And thank you so much for your time. And if there are any other questions, I'll be sure to send them your way.
Cool. Thank you so much, Erica. What a pleasure.
Yeah. Bye.
Bye.
Thanks for joining, guys.